Hi, folks. Thanks for being here today for Safety and Health Magazine webcast, sponsored by JJ Keller. We're going to give our audience just a minute or two to settle in today, and we'll be back with you in just a moment. Thank you. Thanks again for joining us, folks. We're going to give our audience just a minute to settle in here, and we'll start the presentation shortly. Thank you. Hello, everyone, and welcome to today's Safety and Health Magazine webcast. Top 10 OSHA Injury Record Keeping Challenges. Common questions about the OSHA 300 log. Sponsored by JJ Keller. My name is Barry Botino. I'm an associate editor at Safety and Health and a co-host of the On the Safe Side podcast. I'll be serving as the moderator for today's event. Before we get started, I have a few housekeeping items to share with everyone. As a disclaimer, the views of today's speakers and organization are their own and do not necessarily reflect those of the National Safety Council or Safety and Health Magazine. Any mention of a commercial enterprise, product, or publication does not mean the Council or the magazine endorses those items. After today's presentation, we will conduct a Q&A with our speakers. If you have a question, just click the Q&A button located at the bottom of the screen, type in your question, and press the send button. We welcome those questions at any time during today's event. After this presentation, you'll also be asked to complete a brief evaluation survey, but I'll tell you more about that a little later. This webcast will be archived. If you'd like to view this presentation or any of our past webcasts, please go to safetyandhealthmagazine.com/events. Now, let's introduce our speakers. Joining us today are Ed Zaleski and Robin Marth. Ed is the senior editor at JJ Keller, who researches and creates content on a variety of safety-related subjects. He specializes in injury and illness record keeping, walking working surfaces, and powered industrial trucks. Robin joined JJ Keller in 2021 as an editor on the EHS publishing team. She has expertise in various topics, including workplace safety administration, ergonomics, environmental management, and motor vehicle and fleet safety. Again, we thank you all for tuning into this presentation. And Ed, whenever you're ready, please take it away.
Well, thank you, Barry. Thank you, everyone, for joining us. Today's webcast is being sponsored by the JJ Keller Safety Management Suite. This is a safety solution that works as hard as you do. The Safety Management Suite streamlines compliance at every level of your business, making it easy to develop, implement, and maintain an industry-specific safety program. And because your success is our priority, today's attendees will be offered complimentary access to our compliance tools and resources in the Safety Management Suite. So on behalf of that sponsor, JJ Keller Safety Management Suite, thank you all for joining us. All right, before we get started, I want to address a common point of confusion. Now, today we're talking about work-related injuries for OSHA record keeping on the 300 log. But an injured employee might file a workers' comp claim, and that law also uses the term work-related. Now, those two laws, OSHA and workers' comp, they use different definitions. Now, it is entirely possible for an injury to be work-related and OSHA recordable, but the injury would get denied coverage on workers' comp because it's not considered work-related under that law. I've been seeing that same question come around for 20 years now. And it can go the other way as well. Workers' comp might cover an injury, but OSHA says it's not work-related. So, even if an injury is not work-related for OSHA, you might still end up with a workers' comp claim. I can't tell you if workers' comp is going to accept or deny an injury claim. You really need to go through your insurance carrier for that answer, but for the most part, we can usually tell you if something's recordable or not. So now we're going to jump in with the challenges that we'll cover today. This looks like a lot. I know there's 10 of them, but we will get through them all. Now, we selected these topics based on questions from customers over the last several years, and honestly, based on common OSHA violations. Now, you might not face all of these situations, but I'm betting that at least some of these look familiar. And in fact, for several of these issues, the only guidance from OSHA is a letter of interpretation or maybe even a frequently asked question. Well, OSHA has hundreds of letters. I think there's 160 some on record keeping, and there's several hundred FAQs. So finding the one specific item you need that answers these questions can be difficult. We are going to provide that information on the slides today. We'll give you like the date of the interpretation. Barry mentioned, for those of us joining, if you have questions, you can ask them through the Q&A feature at any time. We may take a few as we go along, but despite all the material we're going to cover, we do have time at the end for your questions. So I'm just letting you know, you don't have to wait until the very end to start sending those questions in and putting them in the queue. All right, so top challenge number one, well, maybe not the number one, but certainly a common one. It's on my list. I guess these aren't in any particular order. But my first one involves injuries to temps or contractors. Now, OSHA requires you to record injuries to these workers if you provide day-to-day supervision. Now, that term is used in the regulation, but for some reason, OSHA didn't put the definition in the regulation. I don't know why. However, you can find the definition in the letter of interpretation that's shown here, April 25th, 2017. It actually appeared in the preamble to the rule. It came out way back in 2001 also. It says basically, if you only describe the outcome of a job, then you're not supervising the worker and you don't have to record their injuries. On the other hand, if you describe how they should perform their job, exactly what you want done, the means and methods and processes, then you're providing day-to-day supervision. And if they get injured, you need to record those injuries. Now, to give you an example, if you hire a contractor like a plumber or electrician or a painter, you probably just describe the outcome you want and you don't tell them how to go about doing their job. So if they get hurt, you don't have to record their injuries. Their employer would do that. But most of the time, when someone uses temps from a staffing agency, they usually do explain how to perform the job. You might train them to operate equipment. You might describe how to perform the job duties. Well, that means that you're providing supervision, and that means you have to record their injuries. I'm going to turn it over to Robin for a bit now.
All right. Thank you so much, Ed. And hello, everybody. So continuing on, a couple of related challenges. Now, first, if your company is responsible for recording injuries, then you're also responsible for contacting OSHA if you experience a fatality, an inpatient hospitalization, amputation, or loss of an eye. Now, you can work with the staffing agency when making that call, but if nobody reports the incident, OSHA would cite your company for that failure. After all, your company knows the details of the event. Now, one more challenge that we see is if a temp gets injured and needs days away, you must coordinate with the staffing agency to complete your 300 log. Now, sometimes the agency won't provide medical information, maybe claiming HIPAA privacy. Well, OSHA does have a letter explaining that HIPAA does not apply. And now sharing that letter with a staffing agency might help to encourage them to provide the information that you need. The letter also explains that if the staffing agency still won't give you the information, well, you should record the case as best you can using whatever information you have available. All right, so we're going to take a quick poll here. Since we are talking about injury record keeping, OSHA says that reviewing your injury records can help identify workplace hazards. Now, we're wondering if you've done this. So please answer the poll on your screen with a yes, a no, or a maybe. Maybe you've never checked your injury records for patterns. At a smaller location with only a few cases, you might not have much of a data set, and that's okay. Also, for anyone who found a hazard, please use the chat feature to tell us about it. You can keep your response short. Maybe you found ergonomic injuries or back injuries, or maybe you found a pattern of chemical rashes. We don't need a big long description, but your answers might help some other listeners and hopefully give them ideas based on what you found. All right, so let's check the poll results. So of those that answered, about 85% of you said yes, you have identified workplace hazards by reviewing injury records. Fantastic. About 5% of you said no, and about 10 of you said that you've never checked, and that's okay. Everybody is in the right space in order for us to learn some more. So let's move on to our number 2 topic of the day. So our second item involves injuries to employees who work from home. Now, this became a huge issue since COVID, right? The regulation explains that a work-related injury must occur from performing work at home. Injuries caused by a general home environment are not considered work-related. Now, the regulation gives a few examples saying that if someone tripped over the family dog while rushing to answer a business phone call, the injury would not be considered work-related. However, if that employee dropped a box of documents on their foot and got injured, well, that injury would be considered work-related. Now, OSHA even has an FAQ about a salesperson who was carrying a box of documents out of the car, slipped on ice in the driveway, and was injured. Even though the employee was performing a job task, OSHA said the ice was related to the home environment, so the injury was not considered work-related. Just keep in mind that workers' comp, again, might still consider that an occupational injury and could cover it. All right, so here are a few other situations that we've seen. Now, one customer asked about an employee who was carrying a laptop while walking down a stairway in their home, then slipped and fell. So based on OSHA's response to the salesperson who slipped on the ice in the driveway, that stairway injury should be related to the home environment. So it should not be work-related or recordable. Now, we've also been asked about employees who get ergonomic injuries at home, like carpal tunnel syndrome from using their computer, or even back injuries from poor posture in the home office. Now, although OSHA hasn't published anything on that, at least not yet, we did hear from an employer who contacted OSHA and was told that ergonomic injuries are in fact work-related. Now, using a computer or a mouse is directly related to the job function and not part of the typical home environment. Also, sitting at a home desk is similar to sitting at an office desk. You can contact your local OSHA office about these cases, but don't be surprised if OSHA says that those incidents are work-related. Ed, back to you.
Thank you so much. I'm really enjoying the chat. I got a little caught up looking there. A lot of people pointing out slips, trips, and falls, ergonomics, lifting, and sprains as some of the more common ones I'm seeing for injuries they identified. So I thought that was interesting. Yeah, and whatever you're putting up there, thank you for entering your responses. All right, our third topic involves injuries during travel. Now, we should point out that injuries during a normal commute to and from work are not work-related. So if an employee gets in a car accident while driving to work or driving home, that's not going to be recordable, even if they get, medical treatment injury. But if employees travel between job sites during the day, or maybe they drive to another city, that is usually work-related travel. Now, again, OSHA uses the term normal commute, but they don't define it, and it's not easy to define. I mean, it's pretty easy when employees report to the same location every day. And sometimes, even if they report to different locations each day, different like construction sites, the drive from home to the first job site of the day is usually considered a normal commute, and then going from the last site back home. But sometimes employees might drive a couple of hours to a facility that they visit only once or twice a month. Well, that's probably not a normal commute. And so if they get injured in a car accident, that injury is probably going to be work related. They're in job related travel. In fact, OSHA has a letter, put it here, from 2022. This was about an employee who finished his workday, went home, and then he got called back to work. They needed him to come in for an emergency. I bet this has happened to some of you. Well, on the drive back, he got injured in a car accident. OSHA said that callback was not a normal commute. So the injury was work-related and the employer had to record it. Now, you might have employees who also travel for business. Once they check into a hotel, they establish a home away from home, and most incidents won't be work-related. In fact, here, you use the same criteria for injuries as if they were working at home. In other words, was the incident related to the job, or was it caused by the home environment, or we might say the hotel environment here? Now, meeting with clients or customers after hours also kind of raises a challenge. The regulation says that injuries while entertaining clients are work-related only if the entertainment was at the direction of the employer. And I got that underlined here. Well, the problem is, a lot of companies expect their salespeople to meet with clients after hours, even if they don't specifically tell them to do so. And that kind of creates a gray area where OSHA doesn't offer much guidance. In fact, I mentioned the preamble before. We had to go all the way back to the 2001 Federal Register. And there, OSHA did say that if an employee goes out for an evening of entertainment with friends, and hey, some of those friends happen to be clients, the employee is not acting under the direction of the employer. But again, in some cases, it's a tough call, and that's about the only guidance you get. If you're uncertain, hey, you can record it, or if you don't want to, make sure you can justify to OSHA why you didn't if you get asked. All right, and back to Robin again.
All right, thanks, Ed. So changing topics here. A common violation is failing to report a fatality or hospitalization. Now, we should point out that OSHA defines an inpatient hospitalization as a formal admission for care or treatment. Now, the hospital can tell you if the employee was formally admitted. You might just have to call them if you need to. Going to the emergency room for sutures or even setting a broken bone is often considered outpatient care. Now, if the employee was not formally admitted for care, you don't have to call OSHA. Also, if an employee gets admitted but only for observation or testing, you do not have to report that to OSHA either. However, the term care or treatment is not limited to medical treatment. Now, of course, OSHA has an FAQ that even if the inpatient treatment qualifies as first aid, the employer still has to report to OSHA within 24 hours. Now, this might be an issue if an employee is admitted for observation due to heat stress and is given fluids. Drinking fluids appears on OSHA's first aid list, but this is still going to count as treatment during an inpatient hospitalization. All right, so another challenge involves motor vehicle accidents. Now, the regulation says you do not have to report events that happen on public roads or on public transportation. But if the injury happens in a construction zone and results in a fatality or hospitalization, you do have to call OSHA and report it. Now, OSHA defines a construction zone as shown here on the screen, but the first warning sign, from the first warning sign to the last warning sign. So you see, OSHA doesn't have authority over vehicle accidents on public roads, but OSHA does have authority to inspect workplaces, and a construction zone is considered a workplace. Now, finally, OSHA says to report a fatality or hospitalization caused by a work-related heart attack. Now, most heart attacks involve personal medical conditions. Now, some employers won't report a heart attack if they're confident that it was not work-related, like, say, an employee with a known heart condition was just sitting at his desk. Still, you might not know if something was work or if work contributed to that event. So if you aren't sure, you should still report it. OSHA won't necessarily investigate because a heart attack doesn't usually indicate a hazard or a potential violation. Now, our safety management suite has a repository of up-to-date or industry-specific OSHA requirements, including record keeping and reporting. It allows you to easily track incidents, near misses, even property damage in what we call our incident center. You can analyze your incident trends through charts and create privacy case logs and sharps logs. Really, it's a great way to keep and maintain your required and non-required injury and illness records in one organized place. If you would like free access to the Incident Center that I spoke of and all the other tools and resources in Safety Management Suite, please go ahead and let us know by using the poll on your screen. And along with your access, you will also receive our free white paper on injury and illness record keeping.
And I want to remind everyone, keep sending in your questions. We're getting a few in it, and we will have time at the end. We're only about halfway through, which is good. But so we will have time for questions. I did see someone put one in the chat. Put your questions in the Q&A feature, but someone did ask in the chat, does OSHA expect us to perform ergonomic evaluations for employees who work at home? Robin, I might kick this over to you a little bit, but I don't think, I mean, it's not required. I suppose if there was a recognized hazard, it's always a good idea to make sure people are able to work safely without ergonomic injuries. But no, I don't think you need to go into their homes. What do you think, Robin?
No, I agree wholeheartedly. And actually, this question was bounced over to our Q&A. So thank you, Seth, for doing that. But yeah, just to reiterate what Ed had mentioned, OSHA is not going to come to your home or to make sure, you know, they're not going to, they don't expect you to perform those evaluations. It's a little tricky when you've got folks working from home, but you still need to keep track of your home workers, because if you don't have somebody kind of keeping an eye on them, bad habits will form. So it's always a good idea to establish a expectation, and to also come up with some kind of an evaluation, because they may be working in a way that is working great for them right now, but over the long term may be causing or have the potential to cause ergonomic injuries that they might not even be aware of. So it's always good to kind of keep an eye on those things.
All right, thank you. All right, now, hey, we're back to me for number 5. Okay, you probably all know that medical treatment beyond first aid makes a case recordable if it's work-related. Well, OSHA clarified that if a doctor makes a recommendation for medical treatment, the case is recordable even if the employee doesn't follow the advice, or even if the employee turns out doesn't need that treatment. So, for an example, suppose a doctor offers a prescription painkiller and says, take this if needed, but the employee decides they don't need it and they never fill the prescription. Doesn't matter. It still counts as medical treatment, and you'd have to record the case. Along this, and I know this is annoying because some people say doctors will give out ibuprofen at prescription strength, like candy, practically, some of them. I also know that along the same lines, OSHA has said if a doctor prescribes an antibiotic, but the employee never fills the prescription and never gets an infection, well, the case is still recordable. Now, OSHA took this path because they didn't want employers to avoid recordables by telling employees, look, don't fill that unless you really think you need it, and then we don't have a recordable case. It doesn't matter. The recommendation is what makes it recordable. The idea is to encourage the employee to follow that. Problem is, a lot of doctors, most doctors, don't know that when they recommend a prescription, they've now required you to record the case. Now, some people might try working with a clinic if you have regular doctors. Explain, of course, that you want the employee to get any treatment that they need. But hey, if a non-prescription medication would be enough and over the counter, you would prefer that option. Another challenge on recommended treatment involves rigid devices. OSHA says using non-rigid support like elastic wraps is first aid. But if a device is designed to immobilize a body part, then it's medical treatment. In fact, OSHA has a letter where the employer asked about what they called semi-rigid devices. OSHA said, we don't use the term semi-rigid, but really the employer said, hey, there's this device, it has some plastic stays in it. If we remove the stays, is it considered a non-rigid device? Because it's just the doctor just provided an over-the-counter device. You could have bought it in any store. And so they said, if we took the stays out, does that make a difference? Well, OSHA actually said the case would still be recordable because the purpose of the device was to immobilize a body part. So removing the rigid plastic stays did not change the purpose of the device, which is what the doctor offered. Another letter, actually, the last bullet here where the employee buys the brace, this one surprised me when it came out, but an employee with wrist pain was driving to see a doctor. On the way, the employee stopped at a little pharmacy and he bought a rigid wrist brace. Now, the doctor said that's not required, but if you feel, the employee, feel you're getting some pain relief, then hey, keep wearing it. Well, normally an employee's own actions cannot affect how a case gets recorded. So if the employee bought the device and just used it, that would be okay. In this case, though, OSHA said that the doctor's response saying, hey, if it helps, use it, they said that's a recommendation for medical treatment. That counted as a recommendation, and that made the case recordable. So like I said, that one surprised me when it came out. All right, we have another poll question coming up here. What I'm wondering is if you've ever worked with a clinic to help minimize recommendations for medical treatment. Maybe you've asked them to use non-prescription meds when possible. I actually know some employers, a lot of employers have an on-site nurse or on-site clinic, their own medical staff. I know that can really help with communication. So we included that as an option if you have on-site medical, because boy, you get a little bit more control over what's going on and what kind of devices are used, and make sure they're not getting more than what they're needed. While you answer the poll, I do want to share a study I found from NIOSH, National Institute of Occupational Safety and Health, a while back. That agency had done a study and they found that drugs like OxyContin were prescribed considerably more often for work-related injuries than they were for individuals who went for the hospital for at-home injuries. Now, maybe work-related injuries are more serious, and of course, there could be other reasons for the disparity in prescription levels. But the NIOSH study did raise questions about whether doctors might be giving stronger medication than the employee actually needs. And, that's one of the challenges with these recommendations for getting a prescription or getting an antibiotic. All right, I hope a lot of you have answered the poll. So let's see if we can post the responses here and we'll see what we've got. Oh, wow. Almost about 40% of you have worked with a clinic. So that's excellent. And another almost 10% of you have on-site medical. That's about half. The other half haven't. I know this is a challenge, particularly if you're in a state where the employee can choose their own workers' comp doctor. They go to their own doctor. There might not be a lot you can do. But yeah, whereas some states allow you to have like a list of approved workers' comp doctors. And if you do that, you might have had more opportunity to work with them. So I'm glad at least half of you have either done the on-site medical or have tried to work with this. All right. And with that, I'm going to turn it back over to Robin. Thank you for answering the poll, everyone.
Yeah, thanks, Ed. And thank you, everybody, for sticking with us and helping us learn more about your challenges. So moving on, we also get questions about restricted work. Now, sometimes the injured employee, they could work, but they can't drive to the office. And sometimes the employee can work from home. So we'll address that too. And we often get questions about restrictions that don't affect the employee's job duties. Now, if that happens, you don't have to count restricted days. A restriction must affect one or more routine functions, which is defined as duties the employee performs at least once per week. In fact, OSHA answered a question about a restriction that affected a task the employee did only once or twice a month. OSHA said that would not count as restricted work because the restriction must affect a task normally done every week. Now, suppose two employees have restrictions from lifting more than 20 pounds. That might affect the routine duties for one worker and create a restricted work case, but it might have no impact on the other workers. So that would not be a restricted work case. So it's not the nature of the restriction, but rather the effect on the job duties that make the difference. The other challenge with restrictions is finding something for the employee to do. As long as the employee reports to work and does something, OSHA considers that restricted work. Now, usually you want to provide something meaningful, although some employers say that a worker recovers surprisingly faster when given a really boring job. Now, an OSHA letter from 2006 points out that if an employee can't drive and therefore can't get to work, well, that time counts as days away, even if the employer could have provided work within the restrictions. If the person doesn't show up, that's days away. Another letter asked about an employee who couldn't drive but did work partial days from home. Now, OSHA said those would still be days away, not restricted days, even though the employee was working, because the employee normally came to the office. But OSHA also said if that employee normally worked from home 2 days a week, the employer could count those 2 days as restricted since the employee worked only partial days. Now, this is something to keep in mind if you have employees who regularly work from home. Okay, so we're a bit over halfway through our list, but we want to get your feedback. So please, again, use the chat feature to tell us about other record-keeping challenges that you might have. So to keep it simple, we've listed some options here on the screen. So you can just type A or B or more than one. But if you have something we did not list, we would love to hear about it. Maybe you have a challenge just getting employees to report incidents. Or maybe your challenge involves incident investigations and witness interviews. So please use that chat to tell us about your record-keeping challenges.
Oh, and I wanted to, we're still getting questions coming in, and I'm going to leave this up just a moment. We're getting a lot of A, B.
Yes.
Oh, they're coming in so fast. I'm glad we put a few letters in because this makes it so much easier. I think some people are just punching a fist on the keyboard to get all the letters. I want to take a couple of questions I've seen on various themes that we're probably not going to take. People are asking about prescriptions. How do you know if something's prescription strength? That's a lot tougher here. And having tried to figure this out, I know that a prescription can be, for some medications, it might be a single dose at one time, or it might be a total dose per day. So I know deciding is this prescription strength or not is not easy. You might need to talk to a physician or at least call a pharmacist on some medications. Some of them are a little easier to figure out. When over-the-counter medication that says highest dose available without a prescription, that's probably right at the limit, and anything more than that is higher. But for other meds, it's a little more difficult because, like I said, there's a lot of there are sometimes for some medications what would be a single dose, and it might say, okay, anything over 600 as a single dose or 400 twice a day is 800 per day. That's also prescription. So it can be tough. It can be tough to figure out what they are. Wow, we're getting a lot of comments here. So I'm going to have to go through some of those a little bit later. But for now, I'm going to continue on. Thank you, everyone, for your feedback. I'm going to go on to our number 7 item. Okay, so this one has come up fairly often in the last year or two where sometimes an employee gets released to work on restrictions. Maybe they're released to work, they don't even have restrictions, but then the employee wants a day off. Okay, obviously they're taking a day off because their kid's sick, that's easy, but it does happen where the employee says, I'm in too much pain to come into work, or some other reason, something similar to that. So if the employee requests a day off, does that become a lost day? Well, maybe. I said earlier, an employee's decision normally doesn't affect how a case is recorded. So an employee's decision to take a day off shouldn't affect how the case gets recorded. The reason, OSHA says either the employer or a healthcare professional can recommend days away. Well, therein lies the gray area. If you, the employer, agree that the worker needs 1 or more days off to recover from a workplace injury, Well, that's lost time. That's days away then. You, as the employer, essentially recommended a day away. And that comes from the March 22nd, 2011 interpretation here. So what do? Well, basically, OSHA says you have to decide if the employee could have worked or if the employee really needed the time off for recovery. And if you decide the employee could have worked, you don't have to record days away. And we're going to give a couple examples, but I know sometimes some of you, well, let me go through the examples. Maybe this will sound familiar. So let's suppose an employee got an ankle injury and they have restrictions, but you expect them to show up the next day. Well, the next morning he calls in and he says his ankle is so swollen, he can't put a shoe on, doesn't think he can drive safely. He wants to take the day off. Now, if you agree he should take the day off to recover, that now becomes a day away. Okay, another example, let's suppose an employee gets a cut on his hand. It might be a minor one. Needs cleans and the doctor cleans and bandages it. Doesn't give restrictions. I don't know, maybe they needed sutures, maybe they didn't. But the next day, this employee texts a supervisor saying, "My hand hurts, so I'm staying home." You try to call the employee for more information. The employee's not answering the phone. All right, if you reasonably believe that this employee could have come to work, even if they'd done restricted work, then you don't have to count that as a day away. So now when you're making this could have worked decision, you probably need to rely on whatever information the worker provides, but you might also consider that person's work history and reliability. I mean, if the guy with the ankle injury has a really strong work history and he's a trustworthy employee, you probably think, all right, if you think you need a day off, we agree you need the day off. But if the person who texted in saying, "Hey, my hand hurts, so I'm staying home," if they have kind of, you know their work history, their supervisor knows their work history, that might affect your good faith decision on whether the employee could have worked or whether they really needed to stay home. All right, at number 8, another challenge, delays in reporting injuries. Sometimes an employee reports an injury and they said it happened weeks or even months ago. Well, if it happened at work, you have to record it. Now, OSHA says to record it within 7 days of you learning about it. So even if someone says it happened 6 months ago, all right, from the date of the report, you have 7 days to record the case. The thing is, OSHA didn't put a time limit on this. The reason, employees have a lot of reasons for delayed reporting. Maybe it was a minor cut, but it got infected, and now weeks later they need medical treatment, so they're reporting it. You hope they do this, but employees probably don't report every cut and scratch. Or, hey, maybe the employee had a little back pain, didn't think too much about it. Maybe they're taking some ibuprofen when they get home, and now it's been going on for weeks or months, and they report the problem. Okay, men especially tend to ignore pain until it's debilitating, right? That's how we are. Well, so OSHA says when you don't know the date here, how do you record these cases? OSHA says record the case using the date of the incident if you can identify that. So, I mean, here we are in January 2024. If they say this happened in November 2023, you add a new entry on the 2023 log for November. If you don't know the exact date, you can use the date that the case became recordable. Here's an example, carpal tunnel syndrome. It develops over time. You can't identify a specific date of onset. So OSHA said, well, you could record it either using the date that medical treatment was first provided, or you can use the date that the employee first reported symptoms. And that is covered in the letter from way back in 2004 shown here. And back to Robin again.
All right, thanks, Ed. So number 9, our next challenge is when an employee is on restrictions or days away, but then they leave the company. So OSHA says that if an employee retires or they take another job or they leave for reasons other than the injury, you can stop counting the days. But OSHA also says that if the employee leaves because of the injury, you must estimate the total day count on your 300 log. So for example, maybe the employee was seriously hurt and they can't ever go back to work. You've got to include a full estimated day count. In fact, OSHA has an FAQ that if someone gets fired after failing a post-incident drug test, the termination is because of the injury and you have to estimate that day count. But remember, you can also stop a count after 180 days. Now that's a combination of days away and restriction. So again, for example, if an employee had 105 days away and 75 days of restriction, you can stop counting your days. You can also stop counting if you permanently transfer that employee to a different job where the restriction is no longer a factor. So since we mentioned drug testing, that brings us to our final challenge, number 10. OSHA requires employers to create a reasonable procedure for reporting incidents. Now, that rule also prohibits discrimination or retaliation against employees for reporting injuries. Back in 2016, OSHA published several memos claiming that drug testing might deter some employees from reporting. Well, those memos tried to place some restrictions on drug testing. Now, the most current memo is dated from 2018, and it replaced some of those older memos. But one challenge is that employers that are looking for guidance online or using ChatGPT or things like that sometimes find older articles that mention the outdated memos. But the current memo, again, clearly explains that most workplace drug testing is allowed. Now, that memo also covers incentive programs, so it's worth taking a look at. Basically, what it says is that OSHA will allow incentive programs that focus on total injury rates, but they probably aren't a good idea because they might discourage reporting. So it's better for you to create an incentive program that's going to reward your employees for positive things like reporting hazards. All right, and that wraps us up for the day. I know we covered a lot of information, but we hope that you learned a lot. Remember that you can download a copy of the slides. We've got a lot of great information on there for you, and we are recording this event so that you can watch it again. Here we're showing on this slide where to find all of OSHA's interpretations on injury record keeping. Again, as Ed said in the beginning, it's well over 100 of them. But remember, we said that finding the specific item is a challenge, and it is, but it's worth taking a look. We're also showing the FAQ search page, and that, again, has several hundred FAQs. A lot of good stuff in there, again, but if you don't know exactly what you're looking for or how to search for it, it's hard to find relevant information. We know that you probably have a lot of other challenges, but the 10 that we've covered today are some of the more common ones, at least according to the questions that we receive. But before we get to your questions, Ed?
Oh, back to me. All right. So if you haven't sent your questions in, you still have time to do so. We've gotten quite a few. I don't know if we'll get to them all, but we do have a good amount of time, a good 15 minutes or so left. So Rob and I would like to thank our event sponsor, J.J. Keller Safety Management Suite. You can get complimentary access to this. We're going to offer you that. You would have access to all of our popular safety management tools. There are written safety plan templates that you can fill in. There's customizable training programs. There's audit and inspection checklists so you can self-audit yourself. We have the federal regulations word for word, regulatory comparisons, and a heck of a lot more. So use the poll on your screen to let us know your interests. And as a thank you, we will email you our white paper, OSHA Workplace Injury and Illness Record Keeping. And with that, I'm going to turn things back over to Barry, I believe, to wrap up a little bit. He may have some announcements before we start on your questions.
Well, thank you so much, Ed, and thank you, Robin, for sharing your knowledge with us today. Before we start the Q&A, everyone, I want to let you all know about the evaluation survey that we're asking you to complete today. The survey will open in a different screen after this webinar. Your input is really important to us because it does help us to improve our future webcasts. Now, if we don't get to your question today, don't fret. All of the unanswered questions will be forwarded along to our sponsor today. Now let's get to some of those questions. And Ed, I'm going to start with you. A couple of travel questions. First of all, Patrick wants to know, What if an employee drives a company vehicle on the way to work and gets injured?
Oh, that's a great one. And OSHA actually has an interpretation on that. I didn't get it in here, but somebody specifically asked, so the employee's commuting, normal commute to and from work, but they're in a company vehicle. And OSHA said that does not make a difference. A commute is still a commute, even if they're in a company vehicle. So the question is, a commute is excluded because it's an incident of employment over which the employer has no control. Travel from job site to job site is a little different. In fact, there's been some really weird ones. One of the more recent letters, I have to throw this out, an employee, and I shouldn't smile at this, so an employee stopped at a traffic light. There was actually a criminal pursuit going on in front of him. Another person jumped out of the car, opened the employee's driver's door, shot the employee, and stole the vehicle. And OSHA said that's work related because he was on the job at the time. He was present as a condition of employment. So you get some very strange situations during travel, but the commute is out. It's when they're driving from home to work or work back to home. It doesn't even matter if they're in a company vehicle. So even if they have like an electrician's van, a plumber's van, or some other business company car, it's still a commute. It's still not work related. So I hope that helps.
Absolutely. Thank you. And another commute question for you, Ed, really quickly. Celeste wants to know, does a commute to work count if the employee is not hourly?
That doesn't really matter either. Again, commute or not, hourly salary. I suppose it would be, but I don't know, it would be weird. Hopefully, you don't allow this. Maybe if the person's making a business call and on the phone, I really wouldn't want to dig into that, and I would really discourage having people do that. But normally, a commute is just a commute. I know that phone calls during the commute can be a challenge. I'm not sure how OSHA would cover that if they'd still call that a commute, or they say, well, you're actually on the clock at this point. But absent something like that, then no, it wouldn't matter if they're salary or hourly.
Okay. All right. Robin, a couple medical related questions.
Mhm.
Jim would like to know if you could define what's considered inpatient hospitalization for a 24-hour reporting requirement. And he mentions that it's obvious that an overnight stay is, but what about treatment in an ER if someone is treated and released that same day? It doesn't seem as clear cut.
Yeah, so inpatient hospitalizations, formal admittance to the inpatient service of a hospital or a clinic or care or for treatment. Inpatient hospitalization doesn't include trips to the hospital for observation or diagnostic testing only, and it does not include outpatient treatment such as going to the ER for stitches. But you have to have that formal admittance, and I know safety professionals aren't sure if their employee was formally admitted or not. You may find yourself needing to either call their emergency contact to try to get more information if they were admitted, or call the hospital. But there are times when us as safety professionals have to do a lot more to figure out if their employee was actually admitted formally to a hospital, for that. So yeah, if it's just for diagnostic testing, no. But if it's an ER visit that, if they're not formally admitted, then it's not considered inpatient hospitalization.
Okay, great. Thanks for that. Scott wants to know, Robin, do doctors and hospitals have to report to OSHA?
They're not going to report to OSHA for your employees that are admitted. So their responsibilities are care of the patient. Your responsibilities are making sure that OSHA is contacted if they need to be. But the doctors and the hospitals are not going to bother with contacting OSHA on your behalf.
Okay, excellent. Thank you for sharing that. Um, Ed, Jacinia would like to know, what about traveling to the airport after completing a work assignment, for example?
Uh, Generally, driving from home to an airport is probably going to be business travel, not a commute. And again, there was another opinion letter or interpretation on this where an employee was traveling, landed in the Atlanta airport, was driving home, And the question in this one was actually on whether the employee took a side trip for personal reasons, because OSHA has an exception. Well, the employee stopped at a convenience store, gassed up the car, grabbed a snack, and bought a flower for his wife, which was nice. And then when he was pulling out of there, he got in a vehicle accident and was killed. And excuse me, wasn't killed, he was injured. And the company said, well, is that work related? Because he's just driving home from the airport. And OSHA said, just stopping for food and gas was not a personal side trip. And they also said, he doesn't normally commute to and from an airport. So when he's engaged in travel in the interests of the employer, that business travel, OSHA said he is on business travel until he returns to the point of origin, which in this case was his house. So literally, he was on business travel from the airport until he pulled into his driveway. So I think that's as close as I can get to answering when you're talking about, well, what about going to the airport? Most people going to the airport is not a normal daily commute. So it's probably going to
Gotcha.
be travel for the employer.
Gotcha. We do have an interesting question from Annie for both of you. And if someone wants to check out the new record keeping requirements, where can they find them?
Oh, the new one that came out 1904.41, and there's two new appendices. OSHA should have them published on their site now. I know that it was published months ago, in the Federal Register, but OSHA did not publish the new one on their site until January 1st or 2nd, because that's officially when it took effect. But the new e-reporting, electronic reporting through the injury tracking application, that is in 1904.41. It is on OSHA's site now. It's on our site too, on Safety Management Suite. And really, most of the old rule was the same. If you reported last year, you're going to report this year. If you were exempt last year, you're probably still exempt this year. There's just one new category. Certain employers in a narrow set of industry codes that have 100 or more employees will have some additional obligations. I'm not going to dig through it. We could spend a whole hour on it, but it is on OSHA's site now. I hope that
Gotcha.
helps.
Okay, great. Thank you for that. Robin, we have had a couple of questions about, and if you could maybe reiterate an injury that kind of spans over 2 years, 2 calendar years. If you could share just some general information about that. We've had a couple questions come in about that, how to handle an injury that may begin in 2023 and continue into 2024.
Ooh, that's a good question. I might need to divert to Ed on this
Okay,
one,
great.
but
Great.
I know the 180 days still is in play, but Ed, would you maybe be able to answer this one?
Oh yeah, we get that one a lot. I happen to, in fact, I get that one so much, I'm not even looking it up. You can see I'm here. The answer is in 1904.7. Uh, so what it says is they said if there's a case that occurs in one year and carries into the next year, you do not record it in both years because that would indicate a new injury. OSHA says estimate the number of days the employee will be away or will be on restrictions. Put that entry on your 2023 log. You can use that entry to complete the annual summary, your 300A. You can even use that estimate if you submit through the injury tracking application. And then once the exact day count is known, you go back and update the 300 log itself. You go back to last year's entry and update the log so you put an estimate, you use an estimated day, whatever number you have. OSHA also says once you've posted the 300A summary, you don't have to revise it. Even if the number your estimate was wrong, you don't have to revise the 300A, and you don't have to resubmit to the injury tracking application. OSHA has an FAQ on that site also. They said, well, we had a new case we didn't know about and I've already submitted. Do I need to resubmit? And OSHA said, nope, you're good. You're all once you've submitted, you don't have to resubmit when new cases came up. So yeah, use the estimate. And I know it feels weird to people to put like an injury on December 18th and it says what had 90 days away. It doesn't matter that most of that was in the next calendar year. The day count just indicates severity of an injury and allows comparison of relative severity. So the calendar year doesn't actually matter. And as Robin said, you could stop counting at 180 days. Well, anything after about July could potentially carry over into the next year then. So.
Yeah, great. Well, thank you for that. Rebecca had an interesting submission here into our Q&A. She said, I recently had an employee who had restrictions and I offered them work because I was able to meet their accommodations, but they claimed they couldn't work because they were in too much pain. How should I have handled that situation?
Oh, I saw that one come in as we were going over you just make a good faith decision on whether the employee could have worked.
Mhm.
Use what you know about the employee, what you know about the injury. I honestly had one customer who said an employee got a minor cut on their hand, and the next day called in and said, my finger hurts, I'm not coming in. And he's like, I don't know what to do with that. If my finger hurts, like, we could find work for you. You could probably drive with the cut. So I think he decided, you know what, she probably could have worked, could have made it in and worked. So we're not counting that as a lost day. But again, the ankle injury example I gave was also a customer question. They said, we trust this guy. If he said his ankle's swollen and he can't come in, we'll count it as a lost day. So that's what you do here. You make a good faith decision.
Great. Timothy had an interesting question. If you're conducting a plant tour and a visitor on that tour gets injured, do you need to report that?
The visitor is not your employee, then no. You only record cases to your employees. If it's a visitor from one of your other plants, then actually you record it on the 300 log for the facility where it happened. So that's the only way. But yeah, if it's a visitor like a non-employee, you don't record injuries to non-employees.
Okay, thank you for that. We have had a couple medical questions come in, and one from Christopher, who says, if an independent medical examiner confirms the injury is not work-related after originally documenting it on the OSHA 300 log, can I remove it or should I cross it out? Any feedback you both can share on that?
I'm going to start and then I'll give you a minute, Robin. Sorry, that's a
Yeah,
tough
no.
one because yeah, it might not make a difference. And I had said at the beginning, if maybe not everyone was in, but OSHA and workers' comp use
Mhm.
different criteria. So I've seen a great example. I've seen workers' comp cover cases from motor vehicle accidents in a parking lot. I've seen workers' comp accept those claims. OSHA specifically exempts them. So it can be workers' comp, but not OSHA, and the vice versa can happen. So if you look at OSHA's criteria, um, an IME might say it's not work related because 90% of it is outside of work. If OSHA says 10% of it is attributable to work, it's work related. It's on your 300 log. Robin, anything to add?
No, as soon as you had mentioned the workers' comp, that always throws people. So just make sure that you've got those two, the definition from an OSHA perspective and the definition from a workers' comp perspective, that there's a fine line between the two of them. If you do make the determination that you're going to remove or line out something off of your OSHA log, I would just strongly encourage you to make sure that you document why you have made that decision to take it off your log, so that if on the off chance that anybody ever comes to take a look at your log and they ask you why you lined it out, you've got documentation as to why you came to that determination.
Great. Patrick wants to know if an individual is brought in for training, is that considered restricted time, even though training is relatively routine in a lot of organizations?
Depends on whether they would have been in training at that time. So, yeah, I mean, if you said, well, your training would have been next week, but since you're injured and can't do the job, we're going to move your training to this week. I would probably call that an accommodation of a restriction. But I mean, if they were going to be in it anyway, then it's a little tougher. Robin, do you have any feedback on that one?
No, I think you answered. I think you got it, Ed.
Yeah, I think that's a short one. So
Mhm.
I wouldn't try to use training as say, well, he's not on restrictions because we decided to put him in training. I know it's a job duty, but the question is, yeah, the routine functions that Robin covered earlier.
Mhm.
Okay, excellent. Um, Jamie wants to know if an employee takes an over-the-counter medicine, but it's not prescription strength, but the doctor recommends it. Is it recordable?
No, no, if it's not prescription strength, if it's over the counter. So OSHA says first aid is first aid, even if a medical professional provides it. So, like cleaning and flushing and bandaging a wound is first aid. It doesn't matter if they got a medical professional, a doctor, a nurse practitioner doing that, it's still first aid. They also said that medical treatment is medical treatment, no matter who provides it. So, I mean, it probably doesn't happen, but hey, if a coworker is trying to sew up a buddy or actually uses glues, surgical glue is a wound closing. I know people have tried super glue. OSHA said that's a closing device. Now you've made medical treatment, however dumb it might be to try and close a wound with super glue, but that technically is medical treatment, even if a coworker did it. So it doesn't matter if a doctor says take 2 aspirin. If that's non-prescription, that's over-the-counter meds, that doesn't make it recordable.
Okay, thank you. It looks like we've got time for one more question today, and we want to end on Seth's question, who says, "My employers live in a lot of different sites. How can I add them to my campus's OSHA 300 log?"
I get this one on remote workers a lot. If employees don't, and this is in, what is it, 19, I can't remember, 1904, 31, I think, covered employees, 31 or 32. OSHA says if your employees do not regularly report to a single location, you have to link them to a location. So if they work from home, usually you link them to the location from which they're supervised. And I mean, this could be someone works from home in Dallas, and their home office is in Omaha, Nebraska. They would be considered an employee at Omaha because that's where they're linked. So you link them to a fixed
Gotcha.
location.
Okay, great. Thank you. Well, folks, unfortunately, we've run out of time today. We thank you all for attending today's presentation, and we would appreciate you taking the time to share your feedback via our survey. A special thank you goes out today to our terrific presenters, Ed Zaleski and Robin Marth, and of course, everyone from our sponsor at JJ Keller. This ends today's Safety and Health Magazine webcast. Take care, everyone, and have a safe day.